There's definitely disparities between urban and rural healthcare. I'm John Henderson. I'm the president and CEO of TORCH. We've been around for about 35 years, and we are the principal voice and advocate for rural Texas hospitals. Rural communities generally are older, they're poorer, they're sicker, there are more behavioral health issues in rural communities, and access to care can be a real challenge. So travel burden is real. We like to say every Texan matters, and sometimes rural Texans are kind of an afterthought.
Texas is so big. 52% of the counties in Texas are considered rural. A lot of lives that are out there in the rural areas, and 325 rural health clinics that are serving those patients that are in those rural areas. And so sometimes the decision comes down to, am I going to buy groceries or am I going to put a tank of gas in my car to get to the doctor?
Our vision for the future of rural Texas in places like Muleshoe and Sudan and Presidio is that we are able to foster healthier communities that are also more connected to more healthcare services without having to travel. We need partners like Wellpoint to help meet that local need, because the clinics do great work, but they'll never be able to fully meet the needs of that geographically isolated and medically underserved rural community.
The Torch Foundation talked to us a few years ago and asked if we needed any infrastructure. So I applied for both clinics, and the Muleshoe location was approved for a new HVAC unit. Once the HVAC unit was replaced, one, it helped us with our electric bill, and then two, just the air circulation has improved greatly. Just to know that we have the option to work together with them to serve our patients better is always nice to have someone to fall back on if you can't meet a patient's needs.
We were able to commit to $500,000 of grant money, and they worked with us to put the whole program together and then helped us to launch it.
Wellpoint's the only health plan that I'm aware of that actually has put new funding into rural primary care. So they became a quick, supportive partner of ours, and we've been able to do some important work together.
One of our goals for the clinic is to serve our patients well, and I think that working with insurance companies hand in hand is the only way that we can do that, to make sure that they get the best benefit out of that, and we can do what we need to keep them healthy.
The people who work at the rural health clinics are passionate about what they do. They love their communities, and they look for ways to serve them more.
We call it neighbors helping neighbors. It's not just, a patient. It's neighbors helping neighbors, and that really does matter.